Somebody go turn the scanner down, please.
Hey, Lawrence, can you turn those scanners down?
All right.
They have a police scanner on the background. It barks out all the time. It's funny.
Cool. I think we got them covered. All right, here we go, guys. Countdown until we start. 5, 4, 3, 2.
Hi, I'm Brady Calhoun. I'm with WMBB. We're back for another Facts Over Fear session with Representative Neal Dunn. He's joining us from his house today. How you doing, Representative Dunn?
I'm doing well. I'm isolating in place, and I see that you're actually in the office. So shame on you.
Yeah, I'm in trouble. They're following me, but that's pretty normal. What are you going to do? One of the things that I like to do when we have you here is your experience as a doctor and your medical knowledge. We don't have a lot of as much access to that as I would like. So just talk about what we know today. Anything new about the coronavirus? Anything new in the fight against it?
Yeah, so I think there's actually some great news there. We finally got a deep dive in the structure of this virus and the way it behaves, and it's going to look like pretty much every other flu virus looks like, which means to say that that it's seasonal. As it heats up and becomes more humid, this virus should disappear back into the background. Will it reemerge in the fall? Almost certainly. But we will have a level of herd immunity. That's the terminology for the number of people in the population who have been auto-vaccinated. We didn't give anybody any shots, but they got exposed to the virus and they developed immunity to it. And we will have a vaccine, probably not before the end of the year or early next year. But the other good news is therapeutics. There's a lot of good therapeutics coming out off the shelf now, whether it's zithromycin or hydroxychloroquine, and some others too, remdesivir. So I think we're going to be really well prepared for this in the fall.
Yeah. And I mean, I don't want to be a downer, but in the meantime, the death toll seems like it's going to be pretty high. The president's number was 100,000. What are we looking at over the next month here in the United States?
Well, so everybody has their predictions on this number. I would like to think it's a good deal less than 100,000. Honestly, we're still hovering around 4,000 right now, and I'm seeing the curve flattening, where we're going to have, day on day have fewer new cases, not more new cases. And let me tell you what a case is. A case is somebody who presents as ill or sick, and they test positive. There's a whole lot of people testing positive who aren't sick, and that's not a case. That's a positive test. It's a real test. It means they were exposed to the virus, but they're not sick or dying from the virus. So the new caseload is flattening, and I think that's very good news, because when that number gets under 1, it means that you get, that disease is going away. At one speed or another, it's going away.
Yeah, absolutely. Last time we talked, I asked you about the United States not responding quickly enough, and maybe state governments, all kind of responding in different ways. But one of the things we've started to hear lately is some concern that we weren't getting good information out of the World Health Organization, and we weren't getting good information out of China. Is that a concern you share?
That's absolutely a concern. I mean, so China sat on this thing for months, literally months, and that put the whole world behind the power curve. And then when they finally admitted they have a problem, and they put 50 or 70 million people on lockdown quarantine, and it was too late by then. The people had gotten out of the country or out of the province, and we still cannot rely on the numbers they give us out of China. But I think we have more reliable numbers out of places like South Korea and Taiwan, and we can see how that disease actually how it matures, and so I think that it was an awful problem in China. By the way, I want to say that people who fault the American government for the response in this epidemic, they have no perspective. This is the best response to an epidemic in the history of the world. Nobody's ever seen a response like this. We shut down China first, we shut down Italy first, we shut down EU next. I mean, that's ahead of everybody else in the world. There is no better response.
Well, and I wouldn't want to argue with that. I certainly know that a lot of good people are working really hard to make sure that that we save as many lives as possible. I do sort of think, I think is the right word, but I do sort of wonder about how the shutdown worked. Just now in Florida, we've shut down Florida, but I'm sure there are a lot of voices that would say, that should have been done March 1st. We should have stopped spring break when it was going on. I mean, those are, you read the same Facebook comments I do, and I'm sure you see the same sort of concerns.
I do. I tell you what, when we had our spring break fiasco, we had a gentleman who actually had the disease before he ever came. Bay County came anyways. He was sick, but he literally imported the disease, if you will, to Bay County. I look across near 19 counties. That's my district, the congressional district. And if you look at all 19 of those counties, you don't have 100 cases. We probably don't have 50 cases of positive tests, not sick people, just 50 positive tests across 19 counties. So it's a, to grind the economy to an absolute halt over that is, you do a lot of damage. We have a saying in Washington: a bad economy kills people too.
Sure. And that's certainly true. And unfortunately, that seems to be what we're facing. I guess you saw this morning there were, is it 6 million the unemployment claims? I know that I was looking at Florida's unemployment claims yesterday, and the governor has said that the system was basically overloaded. They normally get 3,000 unemployment requests to the state and a day, and now they're getting 25,000 unemployment claims a day. So, what have we done at a national level, and what are we doing at a national level to sort of help people?
So what we'd like to do is to save the jobs and also save the businesses. So, encourage the business owners to keep their employees, and we do that by the government covering their payroll costs, basically, and their sick leave costs. And we cover that for 2.5 months across the board for everybody, and another 2 weeks for sick leave. So there's a lot of money, a lot of liquidity in the system, and we're shaking that through the banking system, directly through the banking system. It doesn't have to go through the SBA at all, just right through the banking system. And we think that money gets freed up tomorrow. So I would encourage all the employers to keep their employees for now. The government's paying for them, so why would you fire them? And to get, we think we stand the entire economy back up in the next 6 to 8 weeks, and that's what we need to do. Remember, these businesses, they made no mistake. They did not do anything wrong. They simply voluntarily shut down because we asked them to.
Mm-hmm. Yeah, and what we're facing is not what we've ever faced in the past in the terms of, the 2008 meltdown or, forgive me for mentioning it, but the Great Depression, in that it's not that it was not a business side failure. It's we've got a pandemic and we forcibly shut down the economy. So coming out of that, is there a way to come out, is that the way to come out of it? We're not in a recession or depression.
Yeah, we think that we put $2 trillion of liquidity in the system that's should be very, very available to everybody, whether you're a solo contractor, an Uber driver, a gig worker, or you work for General Motors. We think we put that liquidity in there, and it should hit the ground if not this week, it's sure going to hit next. And that's a lot of liquidity to jumpstart the economy back up, and that's what I think we need to do. I think it's what we needed to do. Nobody's ever done it before. There is no historical precedent for this kind of problem or this kind of response. But I think it makes sense.
Will it be sometime soon for Infrastructure Week? We've heard about Infrastructure Week a lot in the last 3 years. Does the government need to be bold in government funded infrastructure projects, building new airports or roads or bridges or whatever, and helping people get back to work if the business doesn't reopen?
So I just hope that we get the business back the way it was 2 months ago. Yes, I want infrastructure projects, but I want everybody to go back to work and have everything back the way it was, at the beginning of February. And that's the first thing. And then if we're going to do infrastructure, and which we should do, I think that comes with a good economy, not with this economy.
Okay. So you were saying 6 to 8 weeks, and that sounds wonderful, over here on this end of April. Is 8 weeks so that would be June, where you think we'll be when sort of the economy can, states can reopen, the economy can reopen, those kinds of things? And tell me why.
So first off, I hope, and I believe it's going to be earlier than June, because if you just look at seasonal flu, when does seasonal flu go away? It typically goes away in April, right? I mean, that's when everybody goes, it's Easter, and everybody's healthy again, the sun's out, and that is the normal goal. Now we've carried the isolation orders through to the end of April in an abundance of caution, and I think that's appropriate. But I also don't believe that it. I don't see this lasting into June, because that's just not how the coronaviruses historically behave. And we have a lot of knowledge on coronaviruses, and now we know this virus in a very, very, ultra structural way. We know that it's sensitive to the same things in heat and humidity that other coronaviruses are.
Okay. You're a veteran. How's the VA doing in the middle of this, and what do they need to be doing going forward?
Well, I have great news there. So the VA, has the three missions of taking care of the veterans, but people have tended to forget that the VA also has a fourth mission, and that fourth mission is to backstop, if you will, the health care in the entire country. So every VA hospital has as a mandate and is funded for keeping a cache of supplies, a cache of medicines, a cache of personnel that are ready to back up the normal healthcare system. And they are really well prepared to do that. And that's actually one of the proudest points, I'd say, of the VA health system.
The other question you talk about the VA health system is nursing homes, and VA nursing homes and other nursing homes that we've seen a real danger there. What's being done to protect those populations?
So we love our parents, our grandpa who are in these VA nursing facilities. We want to visit them. We want to know that they're well. That's just not a great idea right now. We need to not introduce infection into those nursing homes, because as we know, they have a lot of multiple resistance to antibiotic bacteria in the nursing homes throughout that's a normal situation throughout the world. So we need to do what we can to keep them isolated, to let them take advantage of the system that they're in without bringing in new problems.
Yeah, absolutely. We've also seen a number of instances where people have behaved badly, behaved against the orders, that have been handed down. I don't know if you saw the story, but there was I guess a Georgia senator who decided to drive from Georgia to Franklin County after being diagnosed. There was in Bay County, there was a local incident where I guess some folks got together in a party. And then you have that church, there's more than one church who have said, we don't care about what the government says. We're going to get our congregations together. What would you say to those folks who are doing this? And then do you think there needs to be some sort of criminal prosecution for these things?
Well, I'm not a big fan of too much government, but I will say that the Georgia senator, and some of my best friends are from Georgia, but the Georgia senator got a police escort right back to the state line. So,
he sure did.
So he didn't enjoy his vacation too much. I think it's foolish to ignore science. I think it's foolish to ignore the things that we know are proper to isolate the disease, and to fly in the face of that just doesn't make sense. So let's ask everybody to be reasonable, to be well behaved, and this we don't have to have a lot of stiff criminal penalties. We just need to look each other in the eye and say, why in the name of are you doing that? You shouldn't do that. That's not good for you. It's not good for your kids. It's not good for your grandkids. Why are you doing that?
Yeah. I think one thing I'd like us to talk about is these stay-at-home orders, because I see people sort of panicking. When we had huge lines yesterday at Walmart and other grocery stores. I mean, to the best of your knowledge and to the best of my knowledge, the grocery stores are still going to be open, next week and the week after, right?
Right.
And the supply lines
and they will be, as long as we got the farmers. We got to help our farmers too, right? Ranchers. We need, these people need to keep going. And I actually had a long conversation earlier this morning with one of the leading farm representatives in the state, and he's telling me, okay, I'm going to farm, I'm going to produce my crops, but I need some help picking the crops. I need some help, from my bankers right now. And, what are you doing there? And those are things that I focus on day to day. I'm saying, I want to make sure that that the farmers are producing things that go to the grocery stores, because, we only have so many supplies, back at cold centers. Yeah,
absolutely. Ultimately, how do you see this playing out? 6 weeks, 8 weeks, and the economy starts back, but then we have a resurgence in the fall that we have to deal with?
So good news in the fall. So, yes, I think in 6 to 8 weeks we're back and we're running. We'll all be saying, wow, that was awful. But here we are. We're back again working. Now, in the fall, we expect seasonal flus to come out again, just like they do every fall. And the good news is, of course, the auto inoculations, if you will, the auto vaccinations, and the fact that we will have better therapeutics. And I can't tell you, the most hopeful situation that I see is the innovative American spirit responding to this disaster. So yesterday I was touring a pair of institutions that actually figured out how to re-sterilize the N95 masks. For at least 3 times. So you're tripling the N95 mask supply overnight. Yeah. And that's huge. And then I've talked to some people working on therapeutics that are just amazing. One woman, she invented the cure for Ebola, and now she's working on this. I like her chances of being successful.
Yeah, absolutely. You mentioned N95 masks, and the original advice was you go out in public, you're not sick, you don't need to wear a mask. I believe that came from WHO, from the World Health Organization. But now there seems to be some waffling on that. I mean, I don't know that you can get them. My thought when I started to see that was, well, I can't get a mask at this point anyway, right? Unless I make my own.
$15, $20 a pop.
Sure.
So I think it makes sense. We knew at the front end of this that the people who need the mask are the people who are sick. You don't
Yeah.
want them coughing and aerosolizing the viral particles into the environment. That's who needs the mask. Now, if you're wearing a mask, what are you doing with the mask? You're playing with it all the time. You're playing with your face. That's not a plus. So I see no reason for that. I say that as a surgeon, a guy who wore a mask. Just about every single day I went to work, I was wearing masks, multiple masks.
Sure.
And it's just, it didn't make sense to me that normal, healthy people wandering around out in the environment are wearing masks.
Yeah, and does that go back to, protect yourself by washing your hands and using hand sanitizer and not going out to begin with unless you have to?
That's exactly right. Well put. I could not have said it better.
All right. Well, I've had some practice over the last 2 weeks of saying some of these things, so that
You're getting good.
that helps.
Good.
Yeah, I'm getting a little bit more comfortable with it. Dr. Dunn, wrap it up in a bow for us. I'll give you the last statement there. What do you want people to know today as we start this sort of 30-day journey in Florida? What do you want to say to folks?
I want to say, people, keep your composure, be calm. There's no sense in panic. Panic does not help anybody. Let's don't buy into the alarmism. Let's take care of each other, the people immediately around you, and let everybody else do the same. Don't go to the grocery store except when you need to be at the grocery store. And this is going to pass. It's going to be a piece of our history in the none too distant future. And work together. This will come back. Remember, America is the single best place to be in the whole world right now. We have the best response. We're the ones who are going to cure this thing. We're the ones who are going to be most ready for it when it comes back in the fall. So, this is, you're in the right place. Take a deep breath, and let's just work our way through it.
All right. Thank you very much, Dr. Dunn. Have a good day.
Thank you.
All right. Thank you, everybody, for watching, and we'll see you guys next time.
Thank you, Dr. Dunn.